This is my friend Sydney. She has very graciously agreed to do an interview with me about bipolar disorder, which I'm going to be doing several projects on this semester. So we're going to start with an interview. This is going to be a very informal interview. We're going to kind of go with the flow. Again, I've talked with Sydney, letting her know that if there's any topics that she does not want to discuss, we can cut that out. We don't need to talk about it here. I can edit that out, things like that. I have not coerced her any sort of way. Right?
Yes, not coerced. You're my choice.
Right. So yeah, this interview should take just a little bit. And then I'm gonna be like stopping every so often to make sure it's still recording, because sometimes
she just stops.
Sometimes she just stops.
Cool. Sounds good.
Also, if I like break character, I'm literally gonna be editing this out.
Okay.
So if you break character, don't worry.
It'll be edited.
Yeah.
I gotcha.
Okay, I'm gonna set a time for like. Okay. Slay. Okay, I'm gonna first ask you about your, I guess, history or maybe story of how you were diagnosed with bipolar disorder. How did that, what age were you, and what did that look like?
Okay.
Yeah.
So to start off with age, this is a recent diagnosis for me. So I didn't get diagnosed with bipolar until about 19 or 20 years old.
Okay.
So not that long ago, about a year or two ago at most. But I started showing symptoms, now that I look back on it and think back on it later, I believe I started showing symptoms around age 9. I had some really aggressive emotional issues growing up, for sure, where it was like kind of like the violent swings of being like really down and really depressed to then more normally functioning. And I think it's important to mention here that the bipolar disorder that I have is type 2. So the mania I experience isn't normal mania, it's more hypomania. And so that in itself can be a challenge to diagnose, just for the sake of it's not as apparent. It seems like you're being more productive maybe, like there's like small things, like, oh, you might not be sleeping as much, but you're like more productive, like I clean when I'm hypomanic, and I get my schoolwork done on time, and like I can tell now, but at the time I had no idea, and neither did anyone else around me. So then growing up, we did like some kind of therapy to try to manage that because we just thought it was depression. And then around 18, I went to like a family care doctor that was like my primary, and she diagnosed me with PMDD, which is like premenstrual dysphoric disorder, because they thought that my cycles of highs and lows really correlated well with my period, at least that's what like my mom would say and stuff like that. So then I was like, okay, yeah, that's normally how it goes. And so then I was on antidepressants for a while just to help with that, and that's when I started experiencing more of like real mania due to like serotonin syndrome, for the sake of I was on like an SSRI, and so you know how like that operates where it doesn't let serotonin be reuptook into the presynaptic cell.
Wow.
And so I believe that's it. I don't want to be wrong, but
sounds good.
But so it just stays there in the synapse, so it's easier for it to be transmitted. And so when you go through hypomania and you have more serotonin being released anyways, and then you're also on an SSRI, that can be pretty detrimental. And like that was what I experienced. So then like a couple months before I got my diagnosis, I had like one of the biggest like kind of breakdowns, I guess, or it was like a weird erratic behavior that was so out of my normal, and like it consisted of things that I would never do. It was like super irrational decisions, like emotionally driven, that really weren't consistent with who I am normally. And so after that, I was like, I have to stop taking antidepressants. There's something wrong. Like I can't keep doing it. And then I told my therapist about this, and she was a little concerned. And then I talked to a psychiatrist who at first was like, nope, because once again, the hypomania made it really hard to distinguish if I was manic or just felt normal. And so they were like, yeah, no, you're probably just like depressed, like still depressive waves. Just SSRIs don't work for you. And then later on, I talked to another psychiatrist, and she was like, there could be the possibility of being type 2 and you have hypomania instead. And so then after I went on medication for that, that's when I started seeing improvements. So
Gotcha. Also, I hope you know, I hope it doesn't distract you that I'm taking notes or something like that.
No,
Okay.
you're good.
Just making sure I get your story straight.
Yes, I gotcha.
So you mentioned that, that you were put on an SSRI because they thought you had PMDD.
Yes.
Are you still diagnosed with PMDD, or did they remove that diagnosis?
I believe that was removed
Okay.
because it was first diagnosed by a primary care doctor, so not even a psychiatrist or like a therapist. So it was just kind of like here you go, like if you need help with managing depressive symptoms, we'll give you medication for it. And so then when I went to a real therapist, they're like, yeah, we don't see PMDD, so that was like removed. And PMDD is typically more difficult to be diagnosed with formally, so it's kind of an oddball diagnosis because it took like a 10-minute session with my doctor for her to be like, yeah, PMDD. So it was a little bit weird of a situation for sure.